Why don't we go ahead and get started today? Hi, everyone. I am Rena Chedgar. I'm a Senior Director at PHAB's Public Health Systems and Services team. And really pleased to have y'all here today on this webinar around building future readiness in public health in partnership with the Institute for the Future and funding support from the Robert Wood Johnson Foundation. I want to quickly move us through a few logistics as we get started today. All of y'all are currently on mute and will stay muted throughout the webinar. We encourage y'all to engage by using the chat function to chat with each other and to ask questions. We will have time for Q&A at the end of the webinar today, and we'll be asking y'all to engage with us using the chat throughout the session. We encourage everyone to keep your cameras on so we can see what y'all are, your reactions and things like that. And then our session today will be recorded and posted to our website. And then just wanted to remind everyone that we also have the ability to enable closed captioning. If you look on the bottom of your Zoom screen, there is a CC button. Feel free to click that button and we'll enable the ability to view the closed captions. So again, really excited to be here today to talk a little bit more about building future readiness in public health. And, as we reflect on this moment for public health and continue to strategize around how we can continue to build and achieve all of the work that public health is tasked with doing, and continuing to react to what comes our way in public health as we always do, and also thinking about how we can play a role in actively shaping about what and where our future looks like 10 years from now. What is the public health system that we envision for ourselves to best do the work of public health, and how are we proactively moving towards that? As we've seen throughout the history of public health, there have been various conditions under which public health has needed to operationalize its strategy, and really want to spend today thinking about what that looks like and offer some tools and approaches that we can adopt now to really kind of embrace that agents of change mindset with thinking about kind of the future in mind. And it wouldn't be a PHAB webinar without, really noting kind of the essential nature of the work of public health in terms of building the infrastructure needed to be able to effectively do the important programmatic work that public health does by building those foundational capabilities that are a part of the foundational public health services as essential to really thinking about what a transformed public health system or a 21st century public health system looks like. So really thinking about that cross-cutting infrastructure through the foundational capabilities that are needed. So I'm really pleased and happy to introduce Rachel McGuire with the Institute for the Future. Rachel is a research director with IFTF who studies the intersecting and interacting forces that shape the future of how we learn, work, play, and care for one another. And we've had a lot of fun thinking about the future when it comes to public health transformation and working with Rachel with our 21st century learning community. So really happy to have you here, Rachel, and please share any additional information about yourself you'd like to share, and I'll turn it over to you.
Thank you so much, Rena. Thanks for the invitation, and thank you all for joining us. Really glad you're here. I just want to take a moment to acknowledge the invitation. It said, "Are you ready for the future of public health?" And I think that's important setting for this, what we're going to do in the next hour, just under, because as you see, it's not what is the future of public health. That wasn't the invitation to come to this webinar. And that's because, as we all know, there is no way to predict the future. So there's not a tremendous amount of utility in spending a lot of time having someone come in and talk about what they think is the future of public health. But where there is value is in this space called strategic foresight, which I'm going to be unpacking today, which is really about learning how to think about the future systematically so that we can turn some of this sense of uncertainty that we all feel today into inspiration for action, sort of picking up on Rena's invitation to think of yourself more as a change agent as opposed to sort of a passive victim or observer of the future. and turn some of this uncertainty that we're feeling into inspiration for action and increase our own ability to be more resilient. Whatever happens in the future, we can be prepared for it. So we have a couple ambitious goals for us all in the next 54 minutes or so, but my hope is that if I've done my job right, you'll walk out of this knowing what future readiness is, and have some ideas about how you might be able to embed strategic foresight tools and processes into your own processes and your own work. So a little bit about the Institute for the Future. We are an independent public interest education and research organization. We were founded in 1968 and we're based in Northern California, in Silicon Valley. Our job, so what we're doing all the time is helping organizations by providing the practical tools, research, and programs that turn foresight, so sort of these visions and concepts about the future, into critical new insights that ultimately lead, ideally, to transformative action in the present. And as I mentioned before, our mission is to help organizations and leaders become future ready. So when I say future ready, we have an actual specific sense of what it means when you've become future ready. So we define future readiness as a state that's achieved when an organization or a group of individuals really is able to anticipate systemic shifts to the external environment, that they can understand the impacts of those systemic shifts on its activities, they can envision desirable futures, and then they can engage in actions to shape desirable outcomes. So our goal is that every organization in the world would have this sense of future readiness. And our argument is that strategic foresight, the field that I'm in, helps everyone be able to anticipate these systemic shifts. And so in how the Institute for the Future organizes our work in strategic foresight, it often follows this cycle that you can see right here, where we start and prepare, we move to foresight, then we go into insight, and then we get to action. And so what I'm going to do right now is actually engage us all into some of this prepare work. And I'll give you some context for why. When I first started at the Institute back in 2006, we had what we called the Foresight Insight Action Cycle, where our notion was that first you try to anticipate these systemic shifts that we're talking about, and you create some visions of the future based on those systemic shifts. From there, you derive implications. What does this mean for our space? What does this mean for our field? And then once you've done those implications, or you've sort of thought through them, both the intended implications as well as the unintended consequences that can happen in the future, at that point, you start to identify actions. What are we going to do in light of the foresight and the insight? But what we found is without spending time in this prepare space, it can be very, very hard to jump from whatever you were just doing minutes before you joined this call to now starting to think about a 10-year future. So whenever we engage in foresight work now, we make sure to take a moment to prepare us. And this was going to be the first opportunity for those of you who are game for it to kind of participate on the chat in its somewhat interactive way. It's hard in these webinars to make it too interactive, but we are going to take a step. So I hope you'll join us here in this first exercise that we call Orient to the Future. And we often will start any sort of exploration in the future through an exercise such as this one, such as Orient to the Future, because what's helpful is to get some level setting on what are people's assumptions and perspectives about the future before you even talk about it. It can be very informative to know before you go into a strategic planning session, before you go into any sort of conversation that is centered around the future, it's very important to know how people feel about the future, what their perspective is about it, because it'll inform all the decisions that you make in that conversation. So what I'm going to do is I'm going to present 3 different statements about the future. And if you're willing to participate, what we'd like is for you to answer, provide your response in the chat, and you'll see that your response is going to fall in a few categories. So let me walk you through the first one. Here's the first statement about the future. By 2035, the health of individuals, families, and communities in the United States will have measurably improved. So there's a few things to think about here. You have to decide for yourself what you think measurably improved means. And as you make that decision, can you share in the chat if you strongly agree and identify that as a 1? If you agree, identify that as a 2 or 3. If you disagree, share that sentiment by giving us an 8 or a 9. And if you strongly disagree with this statement about the future, give us a 10. You'll see there's no opportunity here to hedge in the middle because we all know that you can argue either way in this, but we're just curious, just taking the pulse of the room, the virtual room here, how do we feel about the future of the health of individual families and communities? Rena, what are you seeing?
Yeah, we're seeing kind of a split between two to three. So in the agree category, and 8s and 9s in the disagree. And it's kind of coming in, I think, from what I can tell, pretty evenly split between those two sections right now.
That's
Lots of,
interesting.
yeah, lots of 3s, lots of 8s.
For those of you who are participating, if you want to share in your chat what were you thinking? What was your logic behind how you got to a 3 or how you got to an 8? It's always interesting to see what people pick up on. How are you defining measurable improvement? How are you defining health? Are you a person that sees progress always kind of moving in a positive direction? Are you a person that feels that you're doing the work today so that the future of health will be better? And for those of you who disagree, are you a person that sees current conditions suggesting a different future? How did you come up with your number?
Seeing some chats around thinking about life expectancy and it's the first generation that will live shorter lives than parents. Some around kind of the not feeling optimistic about public health funding overall and the impacts of that. On the flip side, changing kind of some of the strategies directly in the locality where folks work and confident that those will result
Oh,
in changes. Um,
I'm going to move us to the next one for the sake of time. So let's try this again. By 2035, public health in the United States will have transformed. Again, up to your own interpretation on what transformed is, up to your own interpretation if transformation means a positive future or a negative future. But what we're curious here is if you agree or disagree with the notion that public health in 2035 in many ways would be unrecognizable to public health in 2025, that it will have transformed.
this one, while there's still like a bit of a range, it's feeling like the 3s are kind of coming in more frequently here with some 8s and other numbers too as well. But it feels like this one, folks are leaning towards the agree bucket.
This may be a bit of a selection bias of the group that's here, but I mean, it's also good to know that people feel as if they're moving toward a transformation. Again, assuming that the transformation is positive. Can people share some of the thinking behind how they got to their number? And if not, we can move to the third. Should we go to the third?
I think so. Yeah, I'm sure folks are thinking about it, but I think we can move on while folks are thinking.
By 2035, my role, so what you do every day in public health, will have fundamentally changed. How do you think about your role 10 years from now?
I know folks are just starting to put in, but I'm seeing more ones than I think in some of the other areas or the last two questions.
Yeah.
And some threes and eights as well for this one.
Same invitation to tell us how you got to a one. What is it about your role that will need to change so fundamentally? What is it about the next 10 years? Or are you a person that thinks roles change constantly? So this exercise, Orient to the Future, is something that we would do at the start of a workshop with groups, so that as you go into thinking about the future, you're aware of the sentiments of the group. You're aware, like, are you generally optimistic as a group about the future? Are you at a point where you feel an urgency to change in the next 10 years? You can make a number of statements about the future and get people's sentiment about it. And that can give you, it can help reveal how you're going to think about the future, how you're going to start to plan toward that future based on the assumptions you have today. But it's not foresight work, it's prepare work, because you're not anticipating systemic shifts. You're sort of offering the assumptions you have about the future. And so when strategic foresight comes in, when you move from the P to the F, is to start to challenge the assumptions that current approaches will continue working. So if you find a group that says, my role will not change, the first thing you can do in strategic foresight is to just challenge that assumption. And it may be that at the end of the day, you do end up feeling like, no, the work will be essentially the same. It might change in terms of there might be new ways of doing the work, but our objectives are still the same and our goals are still the same. But you spend time challenging that assumption in the beginning of strategic foresight. Strategic foresight is also different from strategic planning in the sense that it brings people together to create a shared long-term perspective. So this isn't about figuring out a plan for your organization or even your field so much as it is to create a shared understanding of the conditions that we think we're headed in. It helps groups anticipate long-term threats and identify strategic opportunities, and it prepares people and organizations for future possibilities. But as you go into doing foresight work, there's a few traps that we've observed that are worth mentioning, because I think sometimes you can feel that other people are better at this kind of work than you are. But in many cases, what you'll find is we all kind of share these same limitations when it comes to thinking really creatively about a long-term future. And the first one is that many of us share a bias toward precision metrics. And this comes from our training, and this comes from our education, and it also comes from sort of the business environment that's very, very comfortable with using data as the clear indication of how to make decisions and move forward. So what can happen is that we have a bias toward these precision metrics that has us interpret empirical evidence as certainty. If there's data, if we can measure it, then we can make some we can draw some conclusions and move forward based on it more so than we can when there's not data. So we have a real bias, we have a real preference to things that we can measure. And the more precise the numbers, the more persuasive they can be. And so this first trap is sort of arguing that if quantitative data dominates your field of view, it can become a trap. And so one thing that we do in foresight work is that we blend quantitative and qualitative data together. So we can weave the two. We can take the strength that comes from areas that have strong quantitative logic to them, but we can complement that with areas that need more qualitative, maybe an ethnographic study in addition to, say, a demographic analysis of a community. Something like that is the kind of work we do in strategic foresight. The second trap is this concept called official futures. And every company, every organization, every government has an official future. Most of them assume growth. So when you talk to an organization about their future, or you talk to a government about their future, there's sort of an assumption that we will continue growing. It just becomes a question of what that growth will look like. What's the pace of the growth? What's the rate of the growth? What's the geographic distribution of the growth? But they don't spend as much time thinking about futures in which, say, there's negative growth or there's no growth, or the way in which they grow is fundamentally different from how they have been growing. And the truth is, you have to have official future. You all, as part of PHAB, have sort of a sense of where you're headed for the future of public health. It's important to have it. It's very difficult to operate without one. But the risk here is if your official future dominates your field of view, it can become a trap. In this picture you're looking at, if you're looking at the slides, is of course the cover of Forbes magazine in November of 2007, in which Nokia, the phone company, had almost 50% of the global market share of mobile phones. And there was sort of a sense that there was nothing stopping them in the future. This was their official future, that they were just going to keep growing. And it was difficult for them to get out of that trap of what the official future was for them. So strategic foresight is going to systematically challenge consensus futures, where everyone's like, well, obviously this is going to happen. Part of the work of strategic foresight is to really unpack that and say, how is that obvious? How is that assumption? And it oftentimes ends up that once you've had the conversation, you say, okay, I buy it. That is likely what will happen. But it invites those kinds of conversations before you just move forward with those assumptions. And it considers multiple points of view and multiple possible futures. So it's encouraging groups to not see a future of negative growth or declining growth as a negative future, that can be one of your many futures, and you build resilience toward how to thrive in any sort of future conditions. And the third trap is this idea that our future selves are strangers to us. And this one actually comes out of neuroscience research, that our brains, when you ask our brains to think about us in the future, we often think of our future self as someone we don't know very well, and also someone we don't have a lot of empathy for. So at a very basic level, the science behind this is that when you think about yourself in the present, our medial prefrontal cortex lights up. And when you think about someone else in the present, that same area of our brain powers down. And when you think about yourself in the future, it is the same powering down that happens as if you're thinking about a stranger. And so when we're asking people to give as much attention and effort to thinking about the future as they think about the present, what you need to understand is you're not wired necessarily to do that. So if you feel that sense of like, I don't think this is as important as the present, or I don't really have a strong emotional attachment to these conversations about the future, that sense of disassociation is something that's wired in us. And so what we do in strategic foresight is try to create processes that help people pre-experience the future. We do a lot of first-person personalizing of the future so that we can start to build an increased level of empathy and care, really, about long-term futures. So those are the three traps that I wanted to bring. There are a few more that we've picked up in the 55 years that we've been trying to get groups to broaden their temporal bandwidth and think more so about a 10-year future as opposed to kind of the present and the near future. But as you start to kind of evaluate yourself and how you approach your own work in strategic planning and futures thinking, just remember that we do tend to have a bias toward precision metrics, so it's something to watch for, that we tend to have an official future that we feel very attached to, and it can be hard to want to debate that official future, or you feel like you're not being loyal to the official future if you challenge that it may no longer hold. And that remember that we're all strangers to ourselves in the future. And so if you have an instinct of like, I just don't actually care as much about the future as I do about the present, know that there's some neurological sort of justification for that as well. Okay, moving right along. My goal here is to kind of provide as much information as we can and then break in about 20 minutes. So there'll be time for Rena and I to take questions and hear your reactions and responses. So apologies for the fire hose, but this is sort of how webinars tend to go. There are three terms that I want to offer up today, sort of fundamental terms that we use in strategic foresight: drivers of change, signals of change, and forecasts. And we're going to start with drivers of change. These are the ones that you all know about. Whether or not you call them drivers, you might call them trends, you might call them mega trends, but this is the stuff that most of us use when we're trying to analyze and make a decision about the future. These are the broad, long-term forces that will shape the next decade or more. They're often measured with quantitative indicators. This is where our bias for precision metrics really do well, because trends can often be supported through quantitative measures. Demography is a great space to sort of remind us all the value of trends work. So there are lots of spaces, particularly in public health, that benefit from tracking quantitative indicators and linear change. They include both the historical and emerging trends that happen at different scales and rates of change. So you might be tracking a change in, say, temperatures, global temperatures, which is moving at a certain pace. And then you may also be tracking the rise of AI and the deployment of AI tools. These are happening at very different scales and different rates of change, but they would, in our world of strategic foresight, they all still fall in this space of drivers of change. And what we like to do is converge multiple drivers to create unexpected outcomes. So in our work, what we like to do with drivers of change is to make sure that we're not just tracking drivers or trends that fit in our field, but that organizations are expanding their view to say, what are the drivers of change? What are the social drivers of change that are influencing public health over the next 10 years? What are the technological drivers of change that are influencing public health over the next 10 years? What are the economic? What are the environmental? And what are the political? So we use this STEEP framework so that we make sure to get as holistic a view of the drivers of change that we can. It won't be exhaustive, but at least it gives you some sense of the different inputs and the different categories that will shape public health over the next 10 years. So to give you some ideas of what drivers of change could look like that are shaping public health over the next 10 years, you've got all the post-COVID public health challenges, you've got decreasing funds allocated to public health, there's a growth in the distrust in science, there's growth in disinformation, propaganda, deep fakes in health and science media ecosystems. There's some of the consistent ones, like the growth in the aging population. You've got the rising temperatures, and then you've got new forms of work, like gig work and other sort of areas in the workspace that may produce more precarity in people's health and well-being. So those are just a few, but of course, this is to just spur you to think, if you had to go through that steep framework and think about the social and the tech and the environmental and the economic and the political spaces and try to identify what are these forces that are shaping public health, do others come to mind that you want to share?
One around growth in AI.
Yeah, good. Yeah, there's a lot of tech. And as you take this, if you were to try to do a steep analysis with your teams, that would be something that would be very helpful. Sometimes we have groups just organically identify drivers of change and then try to place them on the STEEP framework. And it can be very telling to see where you just didn't have any drivers. And it gives you a sense of like, oh, okay, we're not really focused on, say, environmental drivers or we're more in the social drivers than we are in the tech drivers. So oftentimes it's just another way of saying, are we taking a comprehensive enough view of these big forces that will shape our field?
And Rachel, there's a couple of others around a changing workforce,
Nice.
less personal in-person connection, convergence of biological and digital technologies.
Interesting. Okay. Yeah. Great. Okay, so if those are drivers, now I'm going to introduce a concept that I think people are less familiar with. So, like I said, many of us in the social sciences, as well as in the hard sciences, have exposure to trends work. You have you've learned a process that helps you track and analyze data and kind of create linear trends that help you be able to anticipate the future, assuming that we're on sort of a continuation path. So that's very important to futures work, and we do a lot of it in strategic foresight. But there's this other kind of content, there's this other kind of evidence that we spend a lot of time collecting, which we call signals of change. And signals of change are much harder to track, and they're much harder to measure using traditional social science methodologies. These are vivid, eye-opening, real examples about how the world is changing today. So for those of us who have suffered through the decade of listening to everything be described as a disruption, signals of change are the evidence of these disruptions. That people talk about disruptions as if they just arrive one day without any evidence behind it. Our argument would be they weren't on a trend line. So you were never going to catch this disruption by monitoring drivers of change or tracking these mega trends like so many of us do. You have to have a signals of change practice so you can see disruption at its earliest inception. So signals of change are small, local innovations, and oftentimes something that you see in your personal life can be a very helpful signal, especially if you have young children or teenagers tend to be signal generators just by the fact that they're often doing things differently in their lived experience. And what you're always looking at is this just a modern day example of a trend that I'm already tracking, or does this have the potential to disrupt the status quo? They provide vivid details about new and unexpected experiences, uses of technology, social interactions, shifting values, business models, etc. And like I said, when you combine them with drivers, they become the evidence and the data point for these plausible, provocative forecasts and visions of the future. They take what is otherwise a very stable story about the future that's built on trends and drivers, and they make it into something that's much more complex and by result, much more likely to be closer to what the future actually is. Again, we're not in the business of trying to predict the future, but by understanding both the drivers of change and the signals of change, you can certainly come a lot closer to being able to anticipate these systemic shifts along the way. So I'm about to provide a few signals that I think were interesting for this group to think about, but just to provide an example of a signal from the past, because sometimes that's the best way to tell people about signals. I want to talk about Uber, which was often talked about as this disruption that arrived in cities that had no one saw it coming. But actually, if you were in the Bay Area in the 90s, what you saw were these groups of people that would sit on or stand on one side of the bridge, and they would get into strangers' cars and they would carpool across the bridge together. And so when Uber launches in the Bay Area, it wasn't all that strange for people who were very familiar with this kind of practice. It wasn't as remarkable to them to think about people just getting into the cars of strangers, because it had been somewhat of an established practice that the fastest way to get across the Bay Bridge was to just jump in a car with strangers. And so the technology in that case was just enabling a social practice that was already underway. It wasn't the technology that created the practice. The practice was established, the technology enabled it. And then there were outside factors, right? I think many people know that the taxi situation in San Francisco wasn't very good. And so there were sort of business opportunities. And there's lots of explanation for why Uber eventually became so successful. But just to hone in on that social interaction or that social practice, because that was the signal far before the technology invention that is Uber came along. And so that's what we're always trying to spot. What are these changing social practices, or what is a new use of technology that doesn't necessarily have a business model associated to it? Because that can give you a real sense of how the world is changing at its earliest inception. So I'm going to provide 3 signals, and then I'm going to send you off on a signal scavenger hunt on your own. So just to give you some idea, this is a facility. This is a community center, let's call it, in Kanagawa, Japan. And as you can see with me struggling with trying to call it a facility or a community center is because it's a signal, we don't necessarily always have the right vocabulary or the right classification for things. Because we might think of this in the United States as an assisted living center or a nursing home, because it is true that seniors reside here and many people with dementia reside here. But it is also a school for immigrants who are learning Japanese, and it's also a school for a daycare center for children. It has a cafe that's often, and a candy shop. The candy shop is often has people with dementia that are helping do the selling and the collecting of the candy so that there's some social engagement with the children. And it's really designed to maximize social connection. So it's a signal of how we might think about providing care in the future with new boundaries and sort of thinking much more holistically and intersectionally about who needs care and how that care might be delivered. So this exists. That's important to a signal. You can't be inventing something. That's a different kind of foresight work where you're sort of imagining new opportunities in the future. This is a signal, and your questions are like, what would it look like if this were to scale? What would it mean for public health if this is how we thought about assisted living and community centers for seniors in the future, when it's not just seniors that we're targeting in these spaces? Here's another signal. This is the proactive leadership advocating for climate and equity, called PLACE. This is an organization, and one of their efforts is to attempt to map locations in the United States that appear to have less risk of the negative impacts for climate change, and therefore may be best suited for receiving climate migrants. So this is a signal of change because it shows how new we are to this space of, one, can we even map the right places given how we're seeing, climate disasters sort of present in very different ways than we anticipated, in very different places than we anticipated. But the work here is, can we map it? Can we get a better sense of what locations in the United States will have less risk when it comes to climate disasters? And then secondly, it's also provoking us to think about this notion of climate migrants and this idea that could there be value in starting to prepare quote unquote receiving geographies to be better equipped to take on people who no longer can stay in their current locations. So it's a space that needs a lot of discussion. We need to have really important thoughts about what that will look like to be a receiving geography in the United States, and what it would look like to be in a place where you're being asked to relocate. So these are sensitive conversations. And this PLACE initiative is a signal of change because it's one of the first that is trying to take this new sort of approach to geography that overlaps with climate change, and start to think about what it means for communities in the future. It's not right, it's not wrong. It may not be the mapping that we use in 10 years, but it's suggestive of sort of a new approach to thinking about communities and how they form in the future. And then the final signal of change, this is out of the University of Oregon. It's a picture of their Men's Resource Center. And what this signal is what the Men's Resource Center is a physical space on campus that's designed just for men who can spend time thinking about their identity, their well-being, and as the website says, various forms of masculinity. So this is a signal of change that's trying to address the declining rates of men in higher education and the declining rates of the slowing down of the graduation rates for young men in higher education, and sort of looking at the intersection of men well-being and their participation in lots of institutions, including education. It's one that when I've talked about it with other groups, it's agitating. It makes people think very different things about whether or not men should have their own resource centers on campus. Some people say, well, women have them, so why can't men have them? Some people have a different approach to that. But that's exactly what a signal of change is supposed to do: provoke a new conversation and get you to think, what would the impact be if, in this case, every place of higher education had a men's resource center, or maybe said differently, every place that had a women's resource center also had a men's resource center. Something like that, to get you to think about what would be the impact of this if this were to spread. Okay, let me check my time here. So I don't know that we'll have time to actually send you off on a scavenger hunt, because I think it might make more sense for us to open it up to questions. But what I'd like you to do as you sort of begin your practice in strategic foresight is just keep in mind drivers and signals. So if you take a look at your slides here, it might help you to just be able to distinguish drivers from signals. Because in the 20 years that I've been doing this, these signals are the area that people find most helpful for their strategic foresight practice, but also the hardest part to kind of get good at. And I promise you, it's not rocket science. It just takes practice. So remember that drivers are the large, long-term underlying directions of change that will shape the future, and that they are also what you might think of as the mega trends, the macro trends, or what we talk about often as the future forces. Signals are the small, local innovations, and they have to be specific events or innovations that are happening today that you instinctively feel will take us in a new direction. There's a lot of subjectivity when it comes to signals. And the reason why signals are so important is because they help capture emerging phenomena sooner than traditional social science methods do. They're much better at tracking, like I said, disruption and change than, say, trends work are. So I was going to send you on a scavenger hunt and have you sort of share some signals, but I think for the sake of time, I'm going to just cover forecasts, and then we'll open it up for questions and comments. So if you've done your drivers of change work and you've done your signals of change work, what you have then is a good body of evidence to begin to create stories about the future that provoke insight in the present. That's our definition of a forecast. And we say that in order for it to be a useful forecast, it should be plausible and informed by future evidence, drivers and signals from today, but it also needs to be provocative. And so for those of you who are looking at the slides, you'll see that there was this quote on our windows at the front of our office space in Palo Alto that says, "Any useful statement about the future should at first seem ridiculous." So one thing about forecasts is that they shouldn't seem so familiar to the present that you're not sort of jarred by it. It's important that it seem very different. Otherwise, like Jim Dater, who's a professor of future studies at the University of Hawaii, it's not all that useful to have conversations about safe futures that look very similar to the present. You can just sort of carry on with what you're doing if you do that. So we make sure that when we're evaluating the usefulness of a forecast, for us, it needs to be plausible, provocative, and informed by future evidence. And forecasts can take many forms. They can be statements about the future, they can be narrative paragraphs, they can be scenarios, personas, on and on and on. But as long as it's plausible, informed by future evidence, and provocative, you've hit the at least the Institute for the Future definition of forecasting. Okay, so that was a lot that I wanted to get across today, and thank you for your participation and your attention. But here's a summary of most of what we talked about. That the goal here is not to predict the future. The goal is to create future-ready organizations that can anticipate systemic shifts, understand the impacts of those shifts, envision desirable futures. That's often the forecasting work, and then from that forecasting work, make action plans that shape the desirable outcomes. Don't forget that if you're going to do any futures work, you first have to prepare your mind. You got to examine your own assumptions about the future and the assumptions of the people around you before you go in. Keep in mind that there's certain traps that keep us from doing this work as comprehensively and open-mindedly as maybe we could. Foresight is a practice. So in addition to the work you're doing to track quantitative change and trends and drivers, also start building out your signals practice. And I think you'll find that if you work on spotting signals, they'll be very, very helpful for you to feel like you have more of a pulse on change and not feel so blindsided by so much change all the time, because you'll start to build a body of evidence that's much more around disruptions than trends are. Remember that forecasts are not predictions, they're plausible, provocative, and informed by data. And then that last bullet there is all of us can do long-term foresight, and we can apply it to all our work in strategic planning, design, innovation. It's just a practice like everything else. And with that, I'm going to go to Marina's slide, and should I stop sharing so we can?
Sure, yeah, and maybe we can pull this up at the end when we do Q&A. But thank you so much, Rachel. And I think, yeah, really great to continue to dive into the world of futures thinking and giving us all some good approaches and tools to continue to build our practice. So really appreciate all you've shared. And we don't have a ton of questions, so encourage folks to add to the chat as you think of questions. But if we get through what we have and don't have additional ones, perhaps there's time for the scavenger hunt. We can see how.
Yeah, love that.
So one question that came in, and I responded in the chat, but I wanted to confirm, was around as you were presenting, sharing the language of you. So I think sharing, as you all do this work. And someone wanted to just understand, was that in reference to this direct audience or people in general that you were kind of talking through? And I responded with, I think, general audience, but wanted to do a gut check with you on that.
Yeah, I think I think, who knows? I think when I'm saying you, it's anyone who's engaging in any sort of work that's around preparing for the future, shaping the future, creating the future, that sort of thing. So yes, the general you, I would say.
Perfect. Thank you. And then another quick question we had was, can you please share the brain future self-study information?
Sure. Yeah, I'll get that to you. There's actually been a number of them.
Awesome. And we can share that in the follow-up email.
Yeah.
One question that wanted to pose to you is you were sharing around how our brain works and some of the information you were sharing around how our brain works as we think about the future, our future selves, other people's future selves. In your kind of just thoughts or opinion, how does that interplay with how there might be this value put on intervention in healthcare more so than public health prevention work, which really is kind of thinking about the longer term and not necessarily the like reactive needs from a intervention or treatment standpoint?
Yeah, I mean, I think you have a sense of it too. I should mention that a number of these fMRI studies about our future self are funded by financial planning organizations and sort of the retirement industry, because it was very helpful for them. And I think it's also helpful for the medical community to understand that we don't really have a close relationship with our future self. And so whether we're thinking about the decisions we're making today and the impact those will have on our long-term health, or we're thinking about the decisions we're making today and the impact they'll have on our financial well-being in the future, it's sort of the same brain design challenge that we are absolutely more emotionally tied to our present self than we are our future self. So there have been, the first of these studies, I think, came out in 1997, if I'm remembering correctly. So there has been some interesting work in trying to create interventions then with that in mind, so a lot of that pre-experiencing of the future. So whether it's, any of these tech, kind of embodied tech that help you experience what it will like to be older. I don't know if you remember Agnes. I think that was out of MIT, which had you kind of experience what it feel like to walk, and your eyesight be challenged and your hearing, all to like build more empathy toward, at the time it was for clinicians to build more empathy for their patients and the people they were treating. But I think there's also a larger thing about helping all of us just pre-experience the future and therefore have more of a relationship, feel more invested in it because we've built some empathy toward our future selves.
Thanks. I love that approach too. And yeah, that really resonates with me.
Yeah, I'll get
Um,
these over to you guys.
awesome. Yeah, and please add any additional questions y'all have in the chat. I had one just very like tactical around for those who might not be in a role where in a like an organizational leadership role where they're driving strategy. What are some thoughts you have on how everyone, regardless of role in an organization, can contribute to futures thinking? And I know you've shared some tools and resources and kind of approaches, but wanted to pose that.
Yeah, I mean, okay, so, and I'm curious your thoughts here too, Rena, because you've been kind of dabbling in this space for a long time now. I mean, it strikes me that there's a few different ways. Like on the one hand, there's just the mindset of, feeling like you said in the opening that we can all be more change agents about the future, that there's this great quote of like, we're living in someone's future right now. And it's important that we all think about that. Whose future are we living in right now? So this notion that plenty of entities feel like they have agency over shaping the future. And some make the argument that too many of us have kind of given over our power to shape the future to other entities that we deem are like more powerful or have more access, or for whatever reason, they are the ones that get to shape the future. And a lot of our work as an independent not-for-profit in the state of California is to build this notion of future readiness across all aspects of society, that it's not, future thinking is not a privileged few that get to sort of dictate everything. And whether or not you feel like, whether or not you feel like there's equitable access to like the tools that get to, and the tools and the power that get to actually shape the future, at least we're starting with the notion that more of us need to feel like we have the information about the future so that we can make informed decisions about it in the present. More of us have a shared understanding of what the future conditions will look like, so that even if we're not in a position of strategy, we're sort of riding the waves of change, or we're using our sort of our place in it to shape the future in that desirable way that we're looking for. So I'm not sure if that answers your question, but it starts with that recognition that somebody, like, the future does get shaped by people and by the decisions that are made. And maybe more of us need to recognize that if we want a different future, we have to participate in building that. I don't know. What are your thoughts? How do you answer your own question?
Yeah, yeah, thanks. That really resonates with me. You shared that, and I think the note you made around how we can all build our own practice, and I think the more people that are kind of have this practice and using similar kind of language and tools, I think that builds the momentum around what we're all contributing. So I think I would just echo what you said with that language. Um, all right, well, famous last words when I said we might have time for a scavenger hunt. We have one more question, a couple minutes here. And this question is around, would love to hear more around futures work and how it's been applied to any public health system transformation efforts, especially given that the field tends to be focused on drivers, it seems. So I wonder if you wouldn't mind sharing just a little bit of what we did with 21C, and any other thoughts you have around that. I'm happy to jump into after.
Yeah, I mean, and I'm actually looking at the next question too, and it's making me think. So I'm going to come around, but I'm going to start with what's top of mind right now, which is a conversation that you and I had recently, which is when you're looking at a 10-year future that you think those drivers are going to perhaps suggest a pretty negative future, or at least a future that doesn't align with the goals that you've set in this case for this transformation in healthcare and the infrastructure needed. Signals to sort of this next comment can be very helpful because it can in a robust signal exchange can be very helpful because that may be where you start to see innovation. And if you can build and amplify the impact of signals rather than sort of let the larger drivers inform all of your thoughts about the future, you may actually be able to find, sort of turn the impact of those drivers a bit by giving those signals more power and more resources. To the point about the pandemic, which is an excellent one of how that was this opportunity to reimagine and rethink and kind of re-envision, everybody went through it during that phase. There's also a really nice quote, and I'm not going to, well, that I'm going to butcher, but it's essentially the idea that you need to have the reinventions that took place in 2020 were ideas that had been laying around. Like this was an opportunity for people who had already done the work, the strategic foresight work, to bring one of their ideas to life. It was, quote, ready to go at that moment when there was an opportunity for change. So it's another call to action to kind of have strategic foresight, have the practice in your own practice so that when there are opportunities to make changes and sort of transformative changes, you're ready. With 1 minute to go, like the work we did, well, Rena, why don't I have you share some of what we're doing? Because I think you'll be more concise.
Yeah, and I wonder too, when I recognize time, we can also follow up with more information around some of the examples that are emerging. I know we had one more question come in that we can follow up to. But really our work with our 21st century learning community is really all about what does transforming public health look like, and how do we really understand kind of what that 10-year or kind of longer term kind of future is meant to look like, and then how do we build towards that through the approaches that we do in public health. So happy to, I know that was very high level. So happy to follow up in our follow-up information email with a little bit more information. And Rachel, really, really appreciate you and all of your insight, experience, expertise today, and really appreciate everyone engaging in the chat with your thoughts and questions and all of that. So, and Lydia, thank you too from the back end support as well. Encourage y'all to visit the IFTF website, come to our website. We have a webinar evaluation. Would love to get your thoughts and really appreciate it. Thanks for joining today.
Thank you. Thanks, everyone.